We have a good family tradition. My dad was a physician and my uncle was a physician, and I grew up in that environment. I really liked it. I always knew I wanted to do something in the healthcare profession. I wasn't quite sure what. I started as a physician assistant and did that for 15 years before finally kind of biting the bullet and coming back to medical school. And I'm really glad I did. It's a different level of medicine. It's been very rewarding to do that, and I knew that medicine was what I wanted to do the rest of my life, and so I wanted to be the best I could at it, and I felt that going through and finishing medical school was the best way to do that. My I guess undergraduate was actually through PA school, and so they finished my bachelor's for me. I then later went and did a master's degree in healthcare administration at Benedictine University. I guess my PA schooling was at Midwestern University in Chicago, and then my later medical schooling was done with LECOM, the Lake Erie College of Osteopathic Medicine. I typically see older patients. I see adults. Internal medicine is considered adult medicine, and so I focus on the population of people that are kind of starting to become past their prime or in their prime, and I really enjoy that. I like the life experiences that people have. I like to see how it's affected them, affected their health, how it's developed them and turned them into the person who they are. And I think that's a big part of medicine also, is learning who the patient is and what they do for a living, and how it's created and molded them into the person they are, but it's also molded their healthcare and the type of person they become because of the experiences they've had. Part of the reason I came to Cogdell was because the experience I could have here in a rural setting, I feel, is much more fulfilling. I am able to see patients in every scenario. I am able to spend some time in the emergency room. I'm able to see people in the office, and I'm able to see people in the hospital setting and take them through the hospital, and they're still my patient. Whereas in a bigger city, it's all broken up. You're either an office doctor, or you're a hospitalist doctor, or you're an ER doctor. And you don't get the best of everything, is kind of what I would call it. Two of those scenarios, the hospitalist and the ER, you don't get that follow-up. You just see them at their worst possible condition, and you get them to a point where they can get home, but you never get that follow-up. And I think that part of our job as physicians is not just getting them through that, but then helping them continue to find health beyond that. And I think that's really our role as physicians. Anyone can find disease, that's easy. But finding health, helping them get that, that's the art of medicine.